So I want to start by saying thank you to Oaknoll. I want to, and Kim Bergen Jackson. You are the administrator, and Cam Atwater, is that? And Cam, tell me your area that you work in.
I am the volunteer coordinator, and then I'm also a TIPA snow trainer, so I help train our staff for dementia
Awesome. And then Lindsay,
and a CTRS.
there you go. You have a lot of names, all of you behind you. A lot of letters.
I am Lindsay Reed, and I am one of the rec therapy specialists here. So I oversee the health center and assisted living and all things recreation. And I too am also a PAC trainer, TIPA snow trainer, Dementia Live coach, and Dementia Friends coach. So all sorts of dementia education going on.
All sorts of dementia education. So you knew what you were doing going into this. So you took and engaged with Dementia Live back in about September, October. And Oaknoll is in Iowa City. Tell me a little bit about your communities.
Sure. Oaknoll is CCRC, or Life Plan Community. So we serve about 500 residents in 3 different levels of care. So we have independent living, assisted living, and the health center. And we also do home care for some folks. And we have about 300 staff. And we've been here since 1966. And so we're a private nonprofit. We are run by a board of directors, a volunteer board of directors. And a number of us have been here a long time. And we're always looking for ways to help our staff work with people who are living with dementia. So we've done a lot of the traditional dementia things. We do a lot of online training with our staff. But this submersion, if you will, into what it could be like to live for 7 minutes as a person who's living with dementia has had a profound impact on people, I think. It did for me when we did it at UNI. So first we hooked up to do Dementia Friends, and that's how we met Megan Zimmerman. And then Megan introduced us to Elaine and the UNI Dementia Simulation House. It's all sort of connected.
Right.
So we're all Dementia Friends champions.
Yeah. And so you said your area, Iowa City is where you're really wanting to spread out with this and share with the community. I mean, obviously you've been very, very busy training 320 staff, which is amazing in such a short time. Tell me how you got your plan together once you got trained to, really go say, okay, we're going to do this. How did you go about doing that?
Cam did it.
Very organized, obviously.
Sorry, my connection seems to be a little bit spotty, but I think I pieced together, you're asking how we organized training so many staff in that time.
Yeah.
We didn't really know what we were doing, so we just went for it. But we do a weekly or a daily good morning report to our staff. So that was kind of the best way to share the news and get the word out to our staff. We really felt that it was important to start out with our managers first so that they would see the value that we were going to be providing with training all of the staff in the organization. So we started out the first, I believe, 2 weeks training our group of 20 managers. From there, we went down to our leadership team, which is comprised of about 50 people, which 20 of those are managers as well. And then from there, we kind of broke it down to going out to all of the different departments within Oaknoll. So after managers and supervisors were put through the training, came out in our Good Morning report, people were able to self-sign up for a session. So we spent quite a bit of time beforehand just figuring out our availability. We really did 3 or 4 trainings a week to get through our staff. And yeah, they were able to sign up through that link in the email. It typically was a smooth process. There were times where, people didn't show up and we had to reschedule, or last minute people were sick, but we made do.
And we made it mandatory.
Sorry, were you going to say something, Lindsay?
Yeah, so even before that, Kim and Cam worked with Steve Rowe, our CEO, about finding an apartment within our own campus, within our own community. And so that was step number one. We got approval, and then Cam really went to work and she found furniture. We bought a house near Oaknoll that we are going to utilize for something down the road, but we went and pulled, I don't want to say memorabilia, but things to make this apartment home or to feel like a home. So Cam did a lot of that legwork to get the apartment ready.
Mhm.
And as you said, Pam, she is very organized and so had all the documents ready and made it very easy for staff to sign up. And I think once people started to go through it, there was just a lot of excitement and chatter. And so it wasn't hard to get people to buy in and to get signed up and then to get to the training. So it sort of sold itself because of how well it's put together.
Mhm.
So
Yeah,
thank you.
yeah. I was going to ask you if you had a room set up, because for doing all that, having to take everything out, but having an apartment and having it there set up, it was ready to go.
Mhm.
And you didn't have to take the time
Yeah.
to do that. Plus, you had the advantage of seeing the dementia simulation house and how Elaine had set it up. So that was
Yes.
probably a real inspiration for you in what you had envisioned for that apartment. Are you keeping it as is, or?
Mhm.
Oh, perfect.
Mhm. Yeah,
Yeah.
so we intend to open it up to residents now who are not living with dementia, of course, and then caregivers, family members of people who are living with dementia. So that's why the residents started today. And the residents have been sort of looking at the apartment and what are you doing in there? And, so they've been pretty curious about it. So I'm excited that they're starting to sign up. And then we'll open it up to the public. And what we're hoping to get a hold of the University of Iowa students who would benefit. So I'm really hoping that we'll make it part of the aging certificate program, but Lindsay's connected to the rec therapy school, so she could get rec therapy students through nursing, College of Nursing and the School of Medicine, School of Social Work. So we really have a huge connection with the university, and I want all their students to go through it.
That is fantastic. And you said that you also had a faith community. So, I mean,
Yeah.
that's wonderful. I think you're on your way to being a real stakeholder in dementia community initiative, dementia-friendly community initiative. Because really that's what it's all about, is training the different sectors. So yeah, congratulations to you all for getting this off the ground so quickly and running with it. And so you'll be training new staff as they come on, as they're onboarding, and
There's a group orientation program. We were just talking about that. So in February, we'll resume our group orientation. And so we'll be able to get our hands on the new staff as soon as they start at Oaknoll. So that will be ideal.
So talk a little bit about how you feel like Dementia Live augments the online training that you offer.
Who wants to
Or
go first?
differentiates, or just talk a little bit about that. You have obviously online training that you're already utilizing.
Yeah, you want me to go? I don't want to
Sure.
interrupt you.
Yeah, go.
So we already require 8 hours of dementia training for all of our staff. That's unusual. It's not required by the state. Our assisted living, that level of care is required to have a certain number of hours. But we felt like if it was required in one level of care, it should be required in all levels of care. And we have people living with dementia in all levels of care. And so we've already had sort of a strong history having in-person trainings, having access to our staff who are TIPA trained, certified trainers, has really enhanced our dementia program. And that's Cam and Lindsay and another employee of ours, Retha. But the online is sort of, you can just click through that. You're taking it on your own. It's usually when you're at home or when you have a minute to sign in while you're at work. it's not interactive too much. It feels like repetitive and doesn't have as much value as this simulation does. And at first, I have to tell you, I was not sold on the idea. I was thinking, how could it simulate having dementia? But I was a mess at the dementia house. I was really confused and I was really paranoid and I was unsettled. I cried. There was a lot of emotions going on, and I've been a nurse for 35 years. And so I think for me, it's the submersion into the experience, whatever it is you're experiencing yourself. And then we always ask when it's over how they feel when they take the gear off. And I almost cried today when Cam said it, because our residents can't take the gear off. And I think that is the most profound impact on people, is to say, like, were you relieved when we said it was over and you could take the gear off? And they say, yes. And they even said, whoo, today, a couple of them. And so I think actually experiencing what it could be like, it makes a bigger difference than an hour just listening to somebody droning on and on. You guys, what do you think?
So I'll echo what I said this morning. You know, Cam and I do at least 2, if not 3, in-person TIPA trainings each year for our staff. Sometimes it's refreshing things, sometimes it's a new way of looking at something, and we try very hard to make it new and engaging, interesting, you know, so that people can get something out of it. But I've said some of the same things that have said in the Dementia Live session, and people look at me and they're like, yes, okay, that makes sense. And it's just interesting that, you know, from the big perspective, big groups, it's a good thing. It's something we have to do. But these small, intimate setting and being submersed, as Kim said, with the equipment and the experience, and then reflecting on it afterwards, it's just more eye-opening, and the message sinks in better, I think I've found, with these smaller live sessions. And so it's been really cool to people like, okay, we've said this a couple times, but now it's working, you know. And so sort of nailing that point home, and letting it sink in to make changes moving forward.
We're
So-
also asking them, sorry, Pam, but we're also
No.
asking them to apply it to their job. So they're interdisciplinary sessions where we have people from different departments, but we're asking them, like this morning, we asked the staff and the board members, how can you apply this? What one thing could you take out of this session to change? And I don't think we asked them that in the in-person sessions, or, you know, I know nobody says it during the Reliance trainings or the online trainings. Go ahead, Cam. You took off mute.
I think that the biggest thing that I have noticed between these sessions and our online trainings is you don't get a sense of increased empathy from listening to an online training. The common theme that we have heard in nearly every session that we have completed at the end of it is that their empathy and their patience will have increased after this, which I think we couldn't ask for anything more than for our residents to for our residents to feel like staff and caregivers are more patient with them and have a better understanding of what they're experiencing. So I think that that is what sets this apart from so many other trainings that are available.
Yeah, and thank you so much for those comments. And that's really our goal with Dementia Live, is to be a foundational tool to build empathy, that deep understanding, build compassion, so that other trainings that, you know, if they're layered on top of that, like the online training, it hits home. Some of the things they'll learn, they can maybe look at it differently because they've gone through Dementia Live. So, you know, is it more impactful when they hear some of the training that is delivered online, which TIPA has great training? Does it make more sense after they've gone through Dementia Live and gotten that really strong foundational tool, understanding and in-depth empathy? And obviously, you know, your staff has grown from that, from what you've said. You've seen a difference in how they are responding and interacting with the residents.
Well, I'd say for me, the opportunity to see Cam and Lindsay in this leadership role, this teaching role that they've taken on, it has been really powerful for me to just sit and watch them. Makes me emotional. I'm emotional anyway, but yeah, it's been really, really cool to see. And people respond to them in a way that they don't get a chance to respond to them to otherwise. You know, I mean, we've worked with all the dining services staff. We don't see a lot of the servers. And we certainly don't see them in this level of intimacy. So I'm very pleased about that.
Yeah, gives you a chance to really talk to your team in those small group empowerment sessions and get their feedback where you don't always have the opportunity to connect with them in that small group. And sometimes aren't they more willing to share some things when there's just a few of them about their emotions, their struggles, their, just when they get out, like you, Kim, they're probably very emotional. So as you move forward and you start to share this with families, have you done any sharing yet with families?
Well, two of the residents today had spouses who were living with dementia or who have passed away since in the last year or two. One of the board members that we did today has a mother with end stage dementia. So, and I was anticipating that they would be more emotional today, and they were really engaged, but they weren't. The one woman was sad that she didn't have this knowledge when her husband was still here. And I felt bad about that.
Yeah.
But
yeah,
they were really engaged.
Yeah. I think you'll
Yeah.
see a whole new light when you start sharing with families, and
Mhm.
you'll learn even more.
Yeah,
Lindsay,
I think we put an email out to family members, to all of our contacts, especially for our long-term care residents and our residents' families who are living with dementia. I'm not sure how great the response is, but we will continue to push for that. I know we've gotten a little bit, certain family members that have signed up. And so we are going to continue to push for that because of how beneficial it is. So I anticipate we'll do some marketing with getting that message to them even a little bit more, to know that they have the opportunity to learn and grow and to hopefully better caretake for their loved ones down the road, or now and down the road.
Yeah,
this-
and chances are that they will spread the word like your staff have. A few of them will go through, and then in support groups or whatever other family organizations, your activities you have there, they will share with others and say, hey, you really do need to go through this experience.
So one board member from this morning, I can't remember, was it 9:30 to 10:30 we did the first session? So at 10:57, our board member sent me an
Yeah.
email that said, it will take me a while to sort all of this out, but wow, exclamation point. Thank you for making this possible. It's a win.
It's a win. Yeah. And thank you for sharing it with your board members. They all need to, they need to see what the work is that you are doing every day, and the people in their communities. And as you well know, there's more and more people living with dementia who are in independent living and assisted living, and it's going to only increase in the future. So we really believe that everyone needs to go through this, no matter who you are in the community, because it is definitely affecting everyone. And the students you have that are going to be coming through, they will have loved ones. Not only are you preparing them for their careers in serving the aging population, but they too have loved ones already who are living with dementia.
Well, we want to make sure to thank you, Pam, for creating this brilliant experience for people.
Well, thank
Yeah,
you for
it's making a
taking it.
huge difference for folks in Iowa City. Anyway,
Yeah, thank you for those kind words, and thank you for taking it all to the next level. That's what it was created to do, is take it and run with it, because I really believe in my heart that everyone does need this this education, and whatever we can do to build compassion and empathy in our world, for anyone, but especially those with dementia, let's do it. And I'm sure you will all agree. So thank you so much. We consider you now a part of the AGE-u-cate family, whether you want to be or not, you're there.
we do.
I'm sure
we
you
do.
want to be.
We do. We're going to renew this week. Our time is up, so we're going to renew.
Yeah, well, you are great partners. You're exactly like what we like to see our partners do, and that is go and really integrate the program and see the value when you do that.
Mhm.
When everyone in your organization goes through, from board members to every other, member of your team, that is when culture change happens in communities, when everyone gets involved. And I know you already know this. So anything else you'd like to share before we wind up?
Did we forget anything?
I would say you've all advanced to pros on Dementia Live. I can't imagine how many of these you can do it, well, like the back of your hand, right?
I'm trying to think of a fun story to
We were just
share.
saying that this
Uh-oh.
Cam, sorry, you cut out there. What'd you say?
boy. Oh, I was just saying how this morning we were talking about how we feel like we are pros at this point and could lead a session with our eyes closed and in our sleep.
Yes.
We used to have the
absolutely.
books open, I can remember having the book in front of me and having it open, and I don't need the book anymore, but
Yeah,
I
yeah.
still bring it every time.
Yeah, yeah. That's when you know you really do know it front and back, right?
It really isn't represented anywhere else than this program that I've ever seen it. I don't know if I can effectively state, like I said in the email, I don't know if I have the words I need to say to you, thank you. I don't know if there's a better way to get this information out. It's spectacular.